It's World Diabetes Day 2020, and on this occasion, I had to get two of India's foremost consultant diabetologists uh, to have a conversation with me. And I'm very pleased to welcome onto the show Dr. Purvi Chawla and Dr. Manoj Chawla. They're consultant diabetologists and directors, both of them, at the Lena Diabetes Care and the Mumbai Diabetes Research Center, right here in Mumbai City. Wonderful to see you, Dr. Purvi. How are you?
Great, and I'm so happy and excited to be on the show. I've been listening to you at times. I can say I've been going to work just to listen to you while driving. So very happy to be here, Rishi.
That's very kind of you. Thank you very much. Dr. Manoj, I hope the family, extended family, is all safe and healthy. That's the most important question we need to ask each other in this pandemic.
Yes, morning Hrishikesh, and wonderful to be on the show. Well, everybody's doing well, and fortunately, most of us survived the last 8 months. So glad to be here and have this conversation.
Medical practitioners don't have it as easy as us. People in the media, we can still sit in our study and get by with doing interviews, conducting programs, and things like that. But you've had to go out there, which is why my respect for any medical practitioner has really gone up manifold during this crisis. Let's come to the focus of our discussion, which is diabetes. Both of you have been practicing for so many years, and obviously you've noticed a change in patterns of diabetes in this country. What would those changes be? Something that comes foremost to your mind, Dr. Manoj.
Yeah, Hrishikesh. Well, in diabetes, as we understand, in fact, the word pandemic that we use now for COVID has been used often for diabetes over the last several years. It's widespread, the numbers are on the rise, but there are some typical differences that we see in the Indian population. And unfortunately, those aren't great markers of what is happening. The population with diabetes in India is much younger, so it's at least a decade younger than what we see in the Western population. More younger people are developing this kind of type 2 diabetes, which was earlier seen in people beyond the fifth decade. For us now, coming across a 25-year-old, a 30-year-old with type 2 diabetes is just not surprising anymore. And it's not necessarily that these guys are obese or physically inactive. We still don't completely understand all the factors. But one of the changes that we've seen is younger people getting it, problem extending across the economic strata. So there is no, earlier this was believed to be the disease of the rich. Not anymore. We would see this as much as in a cart puller, a rickshaw driver, as in somebody who's living in a high rise building. So we've seen this change happening much earlier, people across the strata getting it, but also importantly, some positive benefits. The awareness has improved. So people nowadays are screening for diabetes much more. They're getting themselves checked, be it through routine checks and screenings or detection camps, which are organized especially on occasion of World Diabetes Day. So we've seen people getting more aware about the disease, people getting more aware about their fitness and the need to maintain good health. So there have been some positive changes, but at the same time, as I said, people, younger and younger people, they're getting this disease and who are largely asymptomatic. They have no symptoms. It's just on a routine check that they realize that the sugars are on the high numbers.
Dr. Purvi, that's a very interesting point, and I completely agree with him. Irrespective of what economic strata you belong to, we had a domestic help, a young domestic help,
Hmm.
who was diabetic. And, there's obviously cause for concern that a lot of these people are asymptomatic. So, what would you like to send out as a message for everybody who's asymptomatic and says, I have nothing to worry about, the symptoms haven't started showing up?
So what happens is, I think if you, first of all, different age groups come up with their own risk levels. I think currently, and I would just like to add before I answer your question now, I just want to add to Manoj's answer that I think the new onset diabetes after COVID infection is also taking toll right now, and that's becoming an emerging identity, and we are learning how to deal with that because some of the cases where steroids have been used, we've seen new onset diabetes, but even without that we are seeing a lot of diabetes post COVID infections. So this year has brought its own challenges in terms of increasing number of diabetes patients post COVID-19. The other thing which you said about symptoms, I think it's always fair and always reasonable to screen almost every year after your 40 years of age in men and women. At least annual screening should be done along with not only HbA1c, which is a 3-month average that we ask for, but also the fasting and post-lunch sugars or an oral glucose tolerance test. But we must also not rule it out completely in the young adolescents or in the 20s when we when we come across these kind of patients who might have risk factors like either they are overweight, obese, physically inactive. And right now with the pandemic, I can see almost everybody just sitting perched on the seats for hours together in front of the computer screens. Yes, that also can lead to diabetes. So I think it's just fair that we screen often in younger patients and then at least annually in patients above 40.
For those of you who've just joined this conversation, it's a World Diabetes Day special. Dr. Purvi Chawla and Dr. Manoj Chawla from the Lena Diabetes Care and Mumbai Diabetes Research Center are with us. Just some added credits. Dr. Purvi is also co-investigator global national clinical trials at the BSCS Municipal General Hospital, and as far as Dr. Manoj is concerned, he's also coordinated a department of diabetology at the Asian Heart Institute at Bandra Kurla. The next logical question would concern COVID, Dr. Manoj. Dr. Purvi just mentioned that these have been tricky times. How have persons with diabetes actually managed COVID and diabetes, the double bomb, as it were?
Well, so I think it's been worrisome times for people with diabetes, and then I'll quickly just refer to that, Rishikesh. I think there's a move amongst at least the physician fraternity to call our persons or patients with diabetes as persons with diabetes and not term them as diabetic, so to say. So there's this move, and
Interesting.
yes,
That's a good thing you've
that's
told
an
us about.
yes. So what's been happening is, of course, because of the correlation or news about people with diabetes or hypertension being more vulnerable to poor outcomes post the COVID infection. Everybody, of course, has realized that, and what we started seeing since the beginning of the lockdown was people trying to get in touch with us. A lot of our patients who had not seen us for the last couple of years and were just managing on their own, obviously now worried about their levels and numbers and trying to get in touch to improve their numbers. And in fact, a lot of those patients have actually managed to do well. In fact, when the lockdown started, there were a lot of reports coming in based on some models in the past about other pandemics and other natural disasters as to how people with diabetes will, worsen in their control, their sugars and their HbA1c will go up. So interestingly, as we observed things when the patient started coming back, Puri and myself at our center decided to undertake a study to look at actually what is happening post the kind of unlockdown. So after the first 3 months, post 1st June, when the first unlock was announced, we started keeping a track of the patients who started coming back to us or consulting us through the video consults and online consults. And interestingly, we found that almost 70% of our patients or the people with diabetes have actually done better in terms of their metabolic numbers, their blood sugars, their blood pressure, and those who could give us the weight or where we could check the weight. So interestingly, people got more aware because of the scare around this disease and the correlation and started taking better care. Of course, a lot of them also had more time on hand. The traveling was not happening. The outside food was not happening. People were more conscious. The families were together. There was probably a more happiness quotient. At least in a lot of families, there was happiness quotient. I'm sure some were troubled as well about spending that much time indoors. So interestingly, these are the things that we saw happening over the last few months.
Also, it must be wonderful that you can now, Dr. Purvi, aid your patients with the latest technology. There have been so many advancements in the field of diabetes management, and persons with diabetes now can reach out and you can offer them a host of measures, a slew of measures. You want to take us through those technological advancements, please?
Absolutely, my delight. I was just going to add that, this pandemic was different from all the previous pandemics because we've seen this technological wave that has, kind of, usurped around. And I think these advances and the better awareness was what, and again, through different media like yourself, I think people were made aware that if you have hypertension, diabetes, or heart disease, then you must actually take help or seek help at the earliest and get that under control in these pandemic times. So I think one of the boons was having a glucose meter at home or just being able to buy that. I mean, the first testing for blood glucose was probably tasting of the urine to see whether it was sweet or not, so many decades ago. And today here we are, where there are sensors that can just sense your blood glucose, and you can transmit that data to your parents sitting across the world or your caregiver sitting in a different city, and you can be managed remotely. So that has been an absolute boon and a blessing for it has not limited our life, it has not restricted us, in fact it has given us wings. So that's one of the major and commonly used technologies. And there are even more there's even more stuff coming up, and I think Manoj can add to that because we both are part of this wonderful association called RSSDI, and he is part of the technology task force over there. So I'll
Yeah, you want to
kind
add
of
to
Thanks,
that?
Purvi.
Yeah, technology.
Yeah. Yes. So, what has happened is there are these technologies called as continuous glucose monitoring devices, which are now widely available for patients to use, which gives them an insight into their sugar movement throughout the day on a continuous basis. There, of course, are the use of insulin pumps. These are largely meant for people with type 1 diabetes who are insulin dependent. And of course, the use of connected glucose meters. So when I say connected, those using glucose meters now, these are connected with apps on the individual user's phone, and they can also be connected to your doctor's clinic. So for us, a lot of our patients who are using particular glucose meters, their data is connected with the software in our system, and we are able to track that. Also, interestingly, Rishikesh, the fact that we were able to help patients even earlier through telecalls, mails, and online consults, this wasn't actually approved in India. So it was only in April this year, post the lockdown, that the Ministry of Health and Family Welfare actually formulated the telemedicine guidelines
Wow.
and made it ethical and right and legal for all clinicians across to use these norms and means of online consults and helping patients. So that's been a very positive move by this government again, validating the need for such a use in these times, and I think that's been a boon for many patients across the country and the world today.
Thank you for joining us on our World Diabetes Day special. I'm in conversation with Dr. Manoj Chawla and Dr. Purvi Chawla. They're directors and consultant diabetologists at the Leena Diabetes Care and Mumbai Diabetes Research Center. Other than that, Dr. Manoj is an honorary diabetologist at SL Raheja Fortis in Mahim, also honorary visiting faculty at the D.Y. Patil Institute of Medical Sciences in Navi Mumbai. And Dr. Purvi is organizing secretary, Women in Diabetes 2020, and an organizing committee member in the CID over the last 3 years, which is 2018, 2019, as well as 2020. On the 20th, which is a week from now, we are also going to celebrate World Hypoglycemia Awareness Day. A lot of people are still in the dark. What is hypoglycemia and the relevance of World Hypoglycemia Awareness Day? Dr. Manoj.
So, well, yes, hypoglycemia in simple terms is lowered blood sugar or the blood sugars dropping low. Now, when we treat our patients with diabetes or manage diabetes, the biggest limitation when we use certain drugs for doing that is the blood sugars dropping too low or excess action of the medications, and hence, or excess exercise or poor eating by the patient and the blood sugars going low. Now, that's an acute emergency in diabetes when the blood sugars go low. People can have sweating, uh, giddiness, excess hunger, tremors. If they don't eat or realize, they may even faint and go unconscious. Now, that is hypoglycemia. And what we are trying to do through this drive is increase the awareness about the possibility of hypoglycemia so that patients, families, the population in general gets to be more aware about this limitation about the treatment, this possibility, and more importantly, once you are aware, the need to take care about when this happens. So simple aspects of keeping glucose gels, glucose tablets, glucose powders, and of course a glucose meter so that you are immediately able to check the sugar when such symptoms happen in a person with diabetes and take immediate action. So towards that, we decided that 20th November, which happens to be the date of birth of Dr. James Collip, who was one of the co-founders of insulin discovery about 100 years back.
Wow.
So this dates back. There were four co-discoverers of insulin who got the Nobel Award also for the same. One of them, the larger uncelebrated one, was Dr. James Collip, who in fact for the first time described the concept of hypoglycemia in his earlier experiments when they injected the pancreatic extract taken from the dog in the experiments and realized that when they were doing this in rabbits, the rabbit went into low sugar and convulsed, etc. They described this phenomenon as hypoglycemia. So
Interestingly, Manoj, I don't know if you did read about that, but he was able to rescue the rabbits from hypoglycemia as well. So not just that he, discovered
experimented.
hypoglycemia or that phenomena, but he even rescued the
That's a
dog
very
of
important point. Otherwise,
hypoglycemia.
people, at PETA would have been very disturbed by hearing that. So I'm
Yeah,
glad you clarified
That's
that.
true.
Our phone lines would have started ringing, I assure you.
this was of
Well,
course 100
justifiably.
years back. Yeah, this was of course
Justifiably.
100 years back, but of course, yeah, this is how the entire thing was discovered. So we run this association of diabetologists in Mumbai called the United Diabetes Forum, of which I'm the founder president, and with many other colleagues. So we decided to start this drive towards the movement called HOPE, which is hypoglycemia prevention and education. And then we celebrate the 20th of November every year as World Hypoglycemia Awareness Day.
Nice.
And we've conducted so many programs, with physicians, with general practitioners and other doctors who take care of patients of diabetes. We conducted several programs around this day and on this day to, kind of increase the awareness of hypoglycemia and management and everything around it. So we have been paying our tribute to that, and we want this movement to, have a ripple effect and more and more people to take initiative in doing so.
I'm going to ask you to just explain two technical terms for me. Either one of you can take that, or maybe, one each. One is HbA1c, and the other is TIR, which I understand is time and range. So, would you please explain?
Purvi can take the HbA1c and I'll take the TIR. Right.
Sure. So HbA1c is nothing but glycosylated hemoglobin, where glucose is, kind of attached to your hemoglobin moiety. And that's what gives us the average blood sugar for the last 3 months. Of course, there are some considerations like, it reflects best what happened in the last 2 to 4 weeks. It can change in certain conditions like anemia or where the hemoglobin itself is deranged. So those kind of conditions obviously occur, but by and large, it's the gold standard of measuring average glycemia or blood glucose, and it's always, we want the entire perspective. It's no longer about just fasting sugars or post lunch sugars or post dinner, but we want this third parameter called HbA1c to actually figure out how the levels of blood glucose have been maintained in the patient for the last few months. And most of the guidelines around the world, as well as our very own guidelines from India, also stratify treatment management or the risk of the patient around this particular parameter. So it's a very well researched parameter, as well as very and well standardized now over the years. So
And
it's very
TIR?
widely used.
So, we explain the HbA1c, and in general, the target HbA1c for all patients is to be ideally kept below 7%. There would be some specific where we would want it higher or lesser, but in general, less than 7%. Now, as HbA1c is the more established metric for overall glucose control. There's been a new metric which is emerging, which is called as time in range. Now, time in range simply refers to the amount of time an individual is spending within a 24-hour period within a pre-specified range of glucose. For most of the people, this recommended range is to stay between 70 to 180. Now, this is, of course, for people with diabetes, and we would want them to be spending at least more than 70% of the time in a day within this range of 70 to 180. We would like them to be spending lesser than 25 to 30%, if at all, above the 180 blood sugar range, and less than 5%, again, if at all, in the low sugar range, which is below 70. So time in range is today emerging as a concept to again look as to how our patients with diabetes are doing in terms of their sugar movement through the day.
So
Today,
if we
sorry.
have to simplify that further, HbA1c is like it's like a snapshot or a picture, and TIR is more of something derived from a video.
Ah, that's very lucidly explained. It's a wonderful analogy. Today, the 14th of November is World Diabetes Day, and 20th of November, a week from now, is World Hypoglycemia Awareness Day. And to raise awareness on both these special days, I'm in conversation with Dr. Purvi Chawla and Dr. Manoj Chawla. They're directors and consultant diabetologists at the Leena Diabetes Care and Mumbai Diabetes Research Center. Other than that, Dr. Manoj is also honorary diabetologist at the Mahavir Medical Research Center in Khar, and honorary diabetologist at the Arogyanidhi Hospital in Villeparle West. And Dr. Purvi is a consultant for pharma majors. She's on advisory boards and delves into product and clinical development. Now, who should be screened for diabetes? It's a very basic question, but perhaps one of the most important questions. Dr. Manoj.
Okay. So, well, in fact, as Puri mentioned earlier in the conversation today, that when you look at people from India, we come into a high risk group just by our ethnicity. So, ideally, everybody above the age of 40 should be screened at least annually or once in 2 years, is the general recommendation. But I would actually go beyond that because of the changing trends that we are seeing in India. Much younger people been detected. Of course, even people today at 25, 30, undergoing stress related to work or other aspects or unhealthy eating habits and so on and so forth. Checking a blood sugar today with the ease of glucose meters available all across is absolutely simple. So I think this should be extended to probably every adult to check their blood sugars to realize how they are doing. In fact, I would love to use this medium to even start a campaign which would say, this Diwali, get your sugars checked. So it's as simple. You go everywhere today. Unfortunately, everybody would have a neighbor, a friend, a family friend, or somebody having diabetes and the means or access to a glucose meter. Well, let's start doing that, and we will be amazed to see that the number of people who never had issues with sugars, realizing that they're either borderline high or they're already there in terms of being a person with diabetes, and the need to then start changing their lifestyle and habits or even take medications. So there is really no barrier. It's a simple test, doesn't cost much. Those were the arguments in the past, that is it cost effective and so on. It really doesn't cost anything. And a lot of associations today would just keep the booths and would be happy to do free screening for the population. So I think every time you get a chance, the general population at large should be screened at least once a year or once every 2 years.
Dr. Purvi, the jury is out on what kind of diet one should have. I mean, dietitians also differ in their opinion. Where do you come from? Because you deal with people with diabetes all the time, and also from a larger perspective. Many small meals in a day or 3 main meals in a day? Like I said, there are two conflicting points of view, and these are all famous dietitians. Some of them say, no, the small meal theory is all bunkers. You've got to have your breakfast, your lunch, and dinner. And people on the other side say, no, it's got to be small meals. Let's have the medical opinion on this.
Okay, so this is my absolute favorite area of research and management also. because I think diabetes is so fundamentally connected with food and what we eat, that you just cannot delink the two. Unfortunately, medical training is not, encompassing currently a lot of fundamentals on diet. They just give you a broad, outline, and one has to make a very conscious effort to actually educate themselves on diet and nutrition, etc. Because we largely were used to leaving that completely to the dietitians, um, completely. So the main thing is that there are so many hundreds of diets out there, and trust me, most of them work if they are at least scientifically devised. The most important part is that you get a medical, a medical person or a trained or qualified nutritionist to actually give you advice on what is good for you. Today, no one diet fits all. You might be responding better to several meals a day, small meals a day, and somebody else with your same structure may respond better to, having eating just once a day. So there are tons of myths around diet and exercise or diet and just what works and what doesn't. If it's scientifically designed, everything works for a short time, but it must be given by a medically qualified person or a nutritionist who is well qualified, and not just a celebrity nutritionist, and is well experienced as well. And the other important thing is that sustenance of a good diet is very important. So if you are able to adhere to any of the diets that have worked for you, then that is the best diet for you. And things again evolve over time, so nothing works for a long time as well. You have to keep changing your strategy in case you're trying to lose weight or you're trying to even maintain that.
That's worthy advice. Dr. Manoj, let's sign off with the theme of this World Diabetes Day this year, today, the 14th of November, 2020.
So the theme for this year for World Diabetes Day, which is given out by the International Diabetes Federation, is diabetes and the nurse. And I think that's extremely important to drive, which is making us realize that nurses form almost 50% of the healthcare workers in any country, including India. And today, a nurse, diabetes educator, or nurses who are trained a little more to understand about diabetes and help in the management and prevention of diabetes are going to play a huge role in our country as well, in terms of helping patients with diabetes, be it the correct use of glucose meters, the insulin techniques, the way to take medications, a little bit of advice about physical activity, understanding hypoglycemia, taking action when it happens, and so on and so forth. So nurses today are a very integral part of what we do. And in fact, we are glad that our center over the last 7 years, Puri and me have been running the National Diabetes Educator Program, which is again training a lot of nurses as well as nutritionists and dietitians in the Diabetes Educator Program, which helps them work with us or work at other centers or hospitals across the country, and be a part of the diabetes care team, because it's so important to have a team today, as no individual alone would be able to help our patients. So diabetes and nurse is the theme. We respect our nurses for what they've been doing in these times of COVID, and we want them to be an integral part, not only in the acute management of disease, but in helping us manage the chronic problems or chronic diseases like diabetes, hypertension, and dyslipidemia.
Wonderful. For all of you, if you're looking for the Chawla's Lina Diabetes Care and Mumbai Diabetes Research Center, the Lina is an Lina as opposed to a double E. So Lina is what you need to search for. If the numbers pop up, you can fix your appointment and be rest assured that you're in great hands. Dr. Manoj Chawla, Dr. Purvi Chawla, happy World Diabetes Day to you once again. And thank you for your valuable time. This was truly an informative and insightful conversation.
Thank you, Rishi. Thank you
Thank
so
you,
much for having
Rishi, for having us here. Thank you.
me. And wishing all the listeners a very happy World Diabetes Day. Stay fit, stay healthy.
Cheers.
Yes, and upcoming Hypoglycemia Awareness Day as well.